Okay, good afternoon, everyone, and welcome to today's webinar, Working with Nursing Students. We've all been there. My name's Kathy Arsenault, and I'm the practice consultant for the Association of New Brunswick Licensed Practical Nurses. I do want to just take a moment and thank you all for joining me today on National Pink Shirt Day. And we do have a really great mix today of LPNs, practical nursing students, and instructors that are logging in today. So I do want to welcome everyone. And from what I understand, there's some classes that are joining together as well. So I do want to welcome all of the practical nursing students to today's webinar as well. So this webinar is based on our recent fact sheet publication titled Working with Nursing Students, and you can find that fact sheet on our website at any time. And we originally decided on this topic after we were having some conversations with the different college campuses, and they expressed that they often had difficulty finding enough preceptors for the nursing students. And I went with this tagline of "We've all been there," because every single one of us has been a student at some point and has gone through preceptorship as we started out in our nursing career. And sometimes it seems that we have to remind ourselves of this simple fact to understand why preceptoring is so important. So during today's webinar, we are going to look at this topic from the perspective of the LPN, the preceptor, as well as from the perspective of the student, the preceptee. We're going to cover what your obligations and accountabilities are during preceptorship, the benefits of preceptorship from both the LPN and student perspective, some perceived barriers to preceptorship and how we can best support students, and how students can help ensure that they have a positive experience as well, because students do have a role to play in this as well. Then we're going to wrap up by just sharing a few tips for students and how nursing instructors can also help. I also have two guest speakers that are going to be joining us today for a panelist discussion at the end of the presentation. So we do have a fairly recent LPN graduate, Dawn Polches, and an LPN instructor from NBCC, Faye Hunter, who I will introduce in full at the end of this presentation. So today is National Pink Shirt Day and Anti-Bullying Day. So I am going to start this presentation by sharing some information on the unfortunate history of bullying that occurs in nursing. The statistics that I'm about to share with you really points to the fact that this remains a really critical issue in nursing and it needs to be addressed. So I felt it really coincided well with this webinar topic because often it is nursing students who are the victims of bullying in the workplace. So the history of bullying in nursing is a long one, and sadly that phrase "nurses eat their young," which I'm sure many of you have heard, is still very prevalent. And it was over 35 years ago, back in 1986, probably before many of you were even born on this call, that researcher Meisner coined that phrase, "nurses eat their young," to explain the bullying behaviors being displayed by nursing professionals in the workplace. So before I share some of those stats with you, I do want to throw out a poll question to you all now. So in a moment, you're going to see a question pop up on your screen. If you could just take a quick second to put in your response, and your responses are anonymous, so you don't have to worry about your name showing up. I won't know who you are, so it just comes in as a number and not a name. So I'm going to launch this first poll question to you. So if you'll see it on your screen there, the first one is just asking if you've ever personally experienced bullying in nursing. And the second one is if you've ever witnessed somebody being bullied by another nursing professional. So I'll just give you a few seconds to answer that question, and I'll share those results with you. They're still just trickling in there. Okay, so I'm just going to share those results with you quickly, and they're not surprising at all. So as you can see, 63% of you have said that you have experienced bullying in nursing, and 80% of you have said that you've witnessed somebody being bullied by another person, nursing professional. So that kind of tells the tale that we are living that here as well. So I'll just take those results down and we'll continue on. So the literature related to bullying in nursing first began to surface in the 1970s, and it's been ongoing ever since. So I'd like you to just pause for a moment and imagine this story. A new student nurse presents for work on a unit she's not worked on before. An elderly client has just passed away, and a senior nurse on the floor asks the new student to take the deceased client's vitals, without telling the new nurse that the client has just passed away. The student returns distraught upon discovering that the client has died and believes that they're the first person to know, or worse, believes they've done something to cause the death. When the student returns to share the devastating news, it's met with laughter from the senior nurse and everyone else who was apparently in on the joke. So sadly, this is one of many similar stories that people have shared over the years, and that it's happened to nursing students when they've first started out in their career, almost like a bit of an initiation that's really not necessary. So what is bullying? Well, there's no universal definition for bullying, but we do know that it always involves someone wanting to control the other person, and it is about a power imbalance between two or more people. Bullying can either be intentional or unintentional, and it can be behavior that's occurring repeatedly over a long period of time, or it could be the result of a singular incident. So WorkSafe BC did recently define bullying, and they stated that it was any inappropriate conduct or comment by a person towards a worker or student that the person knew or reasonably ought to have known would cause that worker or student to be humiliated or intimidated. And I think it's really notable that they included student in their definition, because it has long been recognized that students are often the victims of workplace bullying. And for nursing students, we know that clinical evaluations during their programs, that can really elicit a lot of strong feelings of anxiety or fear. And there was a Canadian study of nursing students, and it showed that the most commonly reported source of bullying came from clinical instructors, even more so than staff nurses. So it's not only an issue in the workplace, but it can also exist within the nursing education programs. So what I'm sharing with you now are some what I find to be very alarming statistics that are related to bullying in nursing. And these stats all came from North American research that's been done within the last 10 years. So this is all very recent data. So 89% of nursing students reported that they have personally experienced bullying, and 87% also reported that they felt incivility in nursing education was a problem. 55% of nursing students stated that they have experienced or witnessed lateral violence during their clinicals and said that they felt humiliated, powerless, and disrespected. They also reported feeling unwanted, ignored, distrusted, disbelieved, unfairly blamed, and publicly humiliated during their clinicals. It's also been reported that 21% of nursing turnover can be attributed to bullying. 34% of nurses who have been bullied have considered leaving the profession as a result. 36% of the calls that are being made to workplace bullying organizations are from nurses, which is more than any other profession out there. 48% of new grads are afraid of experiencing workplace bullying, and 85% of nurses report being verbally abused by another nurse. So I think these numbers are really quite staggering, and the numbers don't lie. This continues to be a serious problem in our profession. So what does bullying look like in nursing? Well, it could really just be someone is withholding information from you that is critical to your job, which of course is a patient safety issue. It could be posting errors on a public bulletin board for everybody to see and critique. It could be somebody finding fault with everything that you do. It involves trying to intimidate another person. Perhaps it's giving out unfair assignments to someone. So maybe one person in particular is getting heavier workloads than anybody else. Gossiping or betraying somebody's confidence. Any rudeness, yelling, or disparaging remarks. Refusing to mentor new staff or refusing to assist them when they're struggling. Publicly reminding someone of incomplete work or errors that they've made, trying to humiliate somebody, excluding someone or giving them the silent treatment, or it could be a combination of eye rolling or any other demeaning body language. And so if we look at what the negative effects of bullying are, well, of course, it's going to lead to very hostile work environments. It's going to lead to very poor job satisfaction. People are often very fearful of going to work, or they're fearful of becoming the next person that's going to become bullied. And it does, of course, result in very poor nursing retention, poor patient outcomes, increased absenteeism, stress leaves, and resignations, and students or new grads leaving the profession, all things that we cannot afford to happen in nursing right now. So why is there so much bullying happening in nursing? Because it really is a complete contradiction of a profession that's supposed to be caring and supportive of others. So there have been a lot of different theories to explain why this happens in nursing, and I am going to share a couple of these with you now. And so I'm not saying I agree or disagree with any of these theories. These are just some that are out there. So one theory has stated that nursing is, we know, it's a female-dominated profession, and unfortunately, women are often negative towards other women, not just in nursing, but in life. And often this spills over into the workplace as women are competing over status, respect, and positions. Another theory is that it's due to the often stressful work environments that we're in. So we do know that nursing can often be a stressful environment. You know, that can be due to trauma that we're seeing, long hours, staffing shortages, and these frustrations are sometimes released onto other nurses. Nursing is also, it's a confining profession. So you're confined to one area for 12 hours or more these days. And when tempers flare and stressors increase, there's nowhere for you to go. There's no place for you to go and decompress. And some of that pent up stress sometimes gets directed towards other nurses. And lastly, it can be due to the hierarchical nature of nursing. So historically, physicians used their power over nurses to bully and intimidate them. That led to nurses creating a division between those who had a diploma program, such as the RN diploma, and those who had a degree status, so the BN. That trickled down between NPs versus RNs, RNs versus LPNs, LPNs versus PSWs, all the way down to treating students or new grads as inferior. But whatever the reason is, it is clear that doing nothing to manage bullying in nursing and nursing education is going to lead to increased bullying in the profession. So what can you do to help? Well, if you are a victim, report it. So underreporting is a problem in the profession of nursing. If you're a victim, label that behavior and call it out when it happens. So don't make excuses for the other person, call it out for what it is and have it addressed. And again, if you're a victim, you should keep a clear record of any bullying incidents, and that includes dates, times, and witnesses. So your organization is going to want to know about anything that's going to compromise a culture of safety. If you're a witness or a leader in your organization, you should advocate for or establish some anti-bullying programs so that it will create an awareness in your workplace and provide tools on how to address it when it happens. You should establish a zero tolerance policy in the workplace. Take a moment to compliment your coworkers. So nothing boosts someone's spirits more than someone just stopping you randomly in the hallway and saying, you know, hey, you did a really great job back there. And of course, volunteer to mentor students and new grads. So if the pandemic has taught us anything, I do hope that one of those things is that we really need to be working together. Hierarchy does not have a place in nursing. We need to all come together and encourage one another in times like these. So with this being National Pink Shirt Day and Anti-Bullying Day, I do hope that at a minimum, we can all just take a moment today to stop and tell a coworker that they're doing a great job today. So with that, we're going to switch gears a little here and really focus on the webinar topic of working with nursing students. And I wanted to start by talking about the initial reactions that people often have when they're approached with preceptorship. So anyone who knows me knows that I like to add a little bit of humor to my presentation. So on the left, we do hope that you're not like Nurse Jackie, if anybody remembers that that show telling the student, you know, I don't like chatty, okay? I don't do chatty, quiet and mean. Those are my people. But in all seriousness, often this is how students are left feeling, and this is what many students have experienced. So that's not a great way for people to start out in their careers. So I do have one more poll question for you before we get rolling here. So you'll see again that question just pop up on your screens if you can just take a moment to answer that poll question. Let's sec here. So there you go. So it's just asking if you yourself have ever been asked to be a preceptor, and if so, what was your initial response to being asked? So I'll just ask you to put in an honest response there, because if it wasn't something you were interested in, just say so. So I'll just wait a few seconds and give you a chance to answer that question, and then I'll share the results. So far we've got a pretty mixed bag of responses. A few more want to put in their answers there. All right, so I'll share those with you now. So 74% of you have been asked to be a preceptor, and encouragingly enough, 64% of you were excited when you were asked and thought that it would be a great opportunity. We have some that were a bit uneasy, didn't really feel they were good enough or ready, and some who were terrified and not ready for that kind of responsibility. So those are interesting results for sure. So I'll just take those down. So that gives us a little snapshot of your thoughts. And so I do thank you for participating in that poll. So I do want to have a look at what the research has shown us as to what people's initial responses are when first presented with preceptorship. And I'd like you to think about these points to see where you fall. So on the left, we'll start with the most common initial responses from the preceptor, which is the LPN. So typically people go one of two ways. They either shy away from it, and avoid it at all costs, or they readily embrace the opportunity and they're really excited about it. So we kind of saw that in those poll results. Often those that are shying away from it, they do so because they find that it's just too stressful and overwhelming to even think about taking someone under their wing and showing them the ropes. Or people might just simply feel that they do not have the time or capacity to be taking on that extra responsibility, because it is true that it does take extra work when you are preceptoring. We're not going to deny that. Some people are shying away from it because they're worried about what kind of accountabilities they have when they preceptor a student. And with that, they're also worried about what would happen if the student made a mistake that resulted in client harm. So again, they're worried about if they would be held accountable for that mistake. And we're going to talk more about this point in the next couple of slides. And finally, if you were preceptoring or had been a preceptor, someone in the past, I'd like you to just sort of think to yourself, did you make yourself readily available to them? And were you taking a collaborative approach with them to help make them feel like part of the team? Because often the student or the new grad does feel like a bit of an outsider coming into this. So now we're going to take a look on the right-hand side for the initial reactions that students have towards preceptorship. So often it is a mixed bag of feeling anxious, feeling nervous, but they're also excited to take this next step in their careers. And those are, of course, all very normal feelings. They're also often very keen to learn. So most people want to do well, they want to learn, they want to be putting their theory into practice. But then it's also flagged with a lot of different thoughts like, well, will my preceptor be welcoming? What if I upset my preceptor? How are they going to react to that? Will my preceptor help me if I have questions or if I'm feeling really overwhelmed? And are they going to make fun of me because I'm new and I'm unsure about myself? So those are a lot of questions and concerns for a student. And I do think it's important that we acknowledge those concerns and fears when we first meet with the student and start working with them, because it is scary to start out in this career and be responsible for somebody else's care. And that's why it's so important that we support and we guide students as they start developing their skills and their confidence. But unfortunately, the reality is that a lot of students are hearing comments like, oh God, here come the students again, like I've got any extra time to be teaching them anything. And it's those negative attitudes and comments that can really have a lasting negative impact on a student's perception of the profession. And it's also a real blow to their ego and confidence when they're just starting out. So often what we're asked here at ANBLPN is, okay, I know preceptorship is important, but do I really have to do it? Well, when we look at our code of ethics and our standards of practice, which are those core regulatory documents that we all have to be adhering to as regulated professionals, it does clearly state that LPNs provide leadership to support and participate in mentoring and preceptorship, and that we also have to be demonstrating effective, respectful, and collaborative interpersonal collaboration to promote and contribute to a positive culture. So those broad-based statements really serve to state what is expected of an LPN in every practice setting, and that includes supporting nursing students, and it encompasses that whole mentoring and collaboration piece. So students are caring for clients, so this does make them part of the healthcare team in which we collaborate with. And we know that preceptorship is an essential component of nursing education. So you really are helping to mold and shape the next generation of nurses. And as great as classroom learning is, nothing really does compare to having that hands-on clinical experience to increase somebody's competence and skills. And that is what is most beneficial to nursing professionals. So yes, you do have a professional and ethical responsibility to preceptor nursing students. So now that we've established that preceptoring is an ethical and professional responsibility, I do want to take some time and talk about some of those perceived barriers that people have about taking on this role, which often makes people reluctant or maybe fearful to take on that responsibility. So as I said, often people are just feeling completely overwhelmed by the very thought of taking on another responsibility on top of, their already busy lives and busy shifts. So we certainly do recognize this to be a very real factor. So it's no secret, especially in the last 2+ years, the amount of stress that nursing professionals have been under with the pandemic. We've had pre-existing nursing shortages that have been made even worse with COVID. We have very heavy workloads. You're taking on new tasks that might not have been part of your regular practice before. All those changing policies that you've had throughout the pandemic, feeling undervalued for the work that you do, it's definitely been a lot. But I think it's also important to note that although, the primary reason for preceptorship is for the student to learn and develop their skills with the appropriate amount of support and direction, the student can also assist you with the assignment. So having that extra set of hands these days is certainly a good thing and shouldn't be seen as a burden to you. People also have a fear of being held accountable if the student makes a mistake that maybe it caused client harm. So like I said, we're going to talk about this one a little bit more in depth in the next few slides. So I will just say right now that as a regulated professional, you are only accountable for what you do and what you don't do. You're not accountable for somebody else's actions. It's just the same as if you were to make a mistake. The RN's not held responsible for the mistake that the LPN makes. So it's the same with the students. Some might also feel that they're not competent enough to take on this role. And if that is your case, then it is probably something that you should discuss with your employer if you feel that you're struggling in the workplace with your own practice. And this next one kind of goes along with it, in that some might just feel that they're way too inexperienced to be a preceptor. And I think these 2 points are valid because we of course want the person who's preceptoring to be a confident LPN with some years of experience under their belt. So if you are a fairly new graduate yourself, or maybe you're just starting out in a brand new practice environment, then it might not be the right time for you to preceptor. And then lastly, some people might feel that they simply don't have anything to offer to a student. But, I truly believe that every LPN has something to offer to a student. So we all have our own set of unique skills, expertise, different personalities, and that's the same for students. So students are going to come to you with different learning styles, different strengths and weaknesses and personalities. So you could really be the perfect fit for a student. So certainly don't sell yourself short. And there's definitely a lot of benefits to being a preceptor. So I do want to take some time to talk about why preceptoring somebody is a good thing. So for one, it really is your opportunity to pay it forward. So one of the greatest things about being a preceptor to someone is being able to take all that you've learned in your career and use that knowledge and skill to be teaching somebody else. So just as someone's done that for you when you were first starting out, now it's your chance to kind of return the favor. It also really serves as a great opportunity for you to be able to share your expertise with students. So I think, over the years, we all find these little tips and tricks in our practice that's, it's improved our assessment skills to pick up on some of these different signs and symptoms. So one of the most valuable things you can do is to share that knowledge and expertise with somebody else. It's also really rewarding to be able to watch the student or the new grad grow and develop into their career. So you might have the opportunity to see them progress from a student to a colleague to a leader, depending on where their career is going to take them. And you might end up in a situation where the person you preceptored eventually becomes the team lead or an instructor, or perhaps an owner of their own business. So wherever they go in their career, you can know that you played a role in their success. And I'm actually still in contact with my preceptor from my orthopedic days, and she really did provide me with a very supportive and valuable experience, and that stayed with me. So I do want to just say thank you, Lori, if you're listening in today. And I think it's also really good to point out that it's no secret that nursing professionals are faced with being chronically short-staffed, often have, very heavy assignments. But if you are preceptoring, know that the student can provide assistance to you as appropriate. So it certainly doesn't mean that we overload them with extra duties and give them tasks that they should not be performing as a student, but they could certainly help you do things like operate the mechanical lift, turn a client, bathe a client, help you walk a client, things like that. And so with all of that in mind, I think it's important for us to remember that preceptors play a really vital role in a student's success. So you can really make or break a person based on their preceptorship experience. So we do want it to be a positive experience, and we do want them to be successful. So we've covered the benefits, but I know there's a lot of people who are often worried about preceptoring because they're unsure about their accountabilities when they're working with students. So before you start preceptoring, you do want to ensure that you yourself have the knowledge, skill, and judgment to guide and support students safely and competently. So as I said, perhaps you're really keen to preceptor, but if you only graduated less than a year ago, it might not be the right time for you to preceptor just yet, because you're still considered a new grad and you're still developing your own skills. You are accountable to keep client safety your priority. So even though the student has the patient, it doesn't mean that you just wash your hands of that patient. So our priority as an LPN is always that client safety. So we still have to ensure that the care the student is providing is safe, competent, and ethical. And we can ensure that that care is appropriate by ensuring that we're maintaining that open and ongoing communication with the student. So you do want to make yourself available to your student and encourage them to come to you with questions. So the last thing we want to happen is for the student to be too intimidated to come to you and attempt to provide care that they're not competent in, because that's going to put client safety at risk, and we are accountable to ensure client safety. And we're also accountable to collaborate with the students, support them, and guide them through their preceptorship. So that means that we're sharing knowledge with them, and we're helping to foster that supportive and collaborative practice environment where they do feel comfortable coming to us with questions. This makes them more aware of their individual learning needs, and it keeps that client safety top of mind. So I would say that the biggest fear and question we hear is, okay, you've told me what I'm accountable for, and that includes patient safety. So what happens if the student makes an error that's caused client harm? Am I going to be held responsible for that error? Well, the simple answer here is no, as I kind of briefly stated before. We're only accountable for our own actions and our inactions. We are not accountable for the actions of any other healthcare provider, and that includes the student. Students are accountable for their own actions and inactions. So if they do make an error, they are also accountable to seek direction and support from their mentors, meaning the preceptor, to address the error and minimize client harm. So this is where the preceptor needs to take a lead role and understand that once you're made aware of the error, you're still not responsible for that error, but you are responsible to then collaborate with that student and provide them with appropriate direction and support to address it and help minimize any client harm that might occur. So again, you don't just wash your hands of the student and say, well, I guess that's your problem. You better go report yourself to the director of nursing. It becomes your role to help them navigate this error. So maybe a student is going to come to you and say, oh, I just gave 80 milligrams of Lasix to Mrs. Smith and I thought it was Mrs. White and Mrs. Smith is not on Lasix. So this is where you're going to take that lead and you're going to start supporting and guiding and saying, okay, we need to get a set of vitals on Mrs. Smith. We need to monitor her intake and output. We need to assess her throughout the shift, make sure she doesn't become dehydrated. We need to go talk to her, make her aware of the error. We need to tell her what we're doing to make sure that she's okay. We need to phone the physician. We need to fill out an incident report. All those things that are required when a med error occurs. And then hopefully once things are under control, you're also then going to take some time to provide further support to the student by talking about, the importance of doing their 3 checks, making sure they're doing proper patient identifications, things like that. So we do want to make it a teachable moment rather than being accusatory and demeaning. So we're all human. We all make mistakes. It's really important that the student learns from the mistake, and it's all part of that learning process. And then finally, as I said, you cannot be held accountable for something that you're not aware of. So if an error has occurred and the student has not made you aware of that error, then they are the ones that are going to be held accountable. So they're the ones that are responsible for notifying you of any errors or concerns that might come up. So I'll start wrapping up the preceptor perspective by giving you a few tips on how you can best support students during their preceptorship. So for one, you need to be aware of the student's individual scope, competence, and knowledge. So like LPNs, all students are going to come to you with different levels of competence and knowledge. So it's important for you to discuss that with your student beforehand so that you want to be aware of any knowledge gaps they might have, any limitations they might have, and that's going to help you determine how much supervision they're going to need and what interventions are going to be appropriate for you to delegate to them. You also want to establish some rapport with the student and provide that supportive practice environment. So every student is going to come to you with some level of nervousness because, they're adjusting to a brand new workplace, they've got new clients, they've got new colleagues, they're adjusting to you rather than their instructor. So we do want to be welcoming and supportive so we can help maybe calm those nerves a little bit. I mean, it would be a really good idea to engage in just a little bit of small talk, let them know what the expectations are for the day, find out if they have any questions before you start. So you do start to build that relationship with them and start setting them up for success. So be sure to let them know what your expectations are. So if you're the person that always arrives, on the unit 20 minutes before the start of every shift, then make sure they know that and that you expect to see them there at the same time so that you guys can be organizing your day together. And as we said before, you do want to maintain that open and ongoing communication with the student. So make yourself available, ask them if they have any questions, encourage them to come to you with any concerns, things like that. You also want to ensure that you're both aware of any policies or procedures that might be in place with your employer as well as the college that might pertain to preceptorship. So these are really essential components of risk management. So it is important that you're both aware of those policies and that you follow them. So it might come down to a policy that states a student has to be supervised for a certain intervention at all times. So there was actually a case in Nova Scotia a few years ago where a client in the emergency room suffered an injury to their sciatic nerve when the student administered an IM injection into the buttocks area. And the hospital had a policy in place stating that students were not permitted to give unsupervised IM injections to that area because of the increased risk factor for injecting in that area. So because of that, not only was the student held accountable for the client harm, but the hospital was also found negligent because they allowed the student to perform it alone. So you do want to be sure that you know your policies. You also want to make sure that you're providing appropriate supervision and delegation to the student. And that's probably the trickiest area for you to navigate, because there can really be a fine line between hovering over somebody too much or maybe not enough. And that's where being aware of their individual competence really comes in handy, and why you do have to continually assess their practice, because there's no tick box to determine this for you, because everybody is unique in their abilities. So it's going to involve ongoing assessment of the student to help you determine what you can and cannot delegate to them. So again, if you fail to supervise appropriately, it could result in negligence by you. So you do need to be aware of, not only workplace policies, but also their abilities. Because if direct supervision is required, then direct supervision has to be given. And we also want to make sure that we're providing that timely and appropriate feedback to students. So let them know things like what went well, what didn't go well, areas they might want to focus on. It'd be a really good idea if you could just take 5 minutes after your shift and just talk about the shift quickly. So find out if there were, maybe there's some areas they want to learn more about. How do they think things are going? Maybe even if you ask them to share 3 things they learned that day, that's going to get them thinking and further keeps those communication lines open. And do take the time to balance the feedback. Not all of it should be negative. We do want to highlight some of their strengths as well. So there was a nursing student that was quoted as saying, it was just like, all I heard was negative. I didn't do this right. I didn't do that right. Before I started, I felt like a confident nurse, but afterwards I almost quit nursing. It was like I suck. So we don't want to leave people feeling that way. And then lastly, I think one thing that's very valuable piece of advice is to not forget to focus on the non-technical skills. So normally the focus of preceptorship is on specific tasks and technical skills like inserting a catheter or an IV, wound care, things like that. But it's equally important to remember the importance of focusing on their soft skills as well. So that, think of things like interprofessional collaboration, therapeutic communication, even talking to them about their licensing requirements, like, when's the registration deadline? What's this CCP program I keep hearing about? These are all essential components of becoming a regulated licensed professional, but often those are the areas that we overlook as well. So our soft skills and our professional accountabilities are areas that students could use guidance and support in as well, because it will be all new to them. So we'll switch gears here and look at things from the student perspective. So students also have a role to play to help facilitate a positive preceptorship. So this is a team effort, and students, you are part of that team. So you can also help make this a positive experience. So for one, we do want to remember to be kind and compassionate with our preceptor. So the LPN that's your preceptor might be dealing with a very heavy caseload. They're fatigued because of overtime and staffing shortages. They're still going through a pandemic as an essential frontline health worker. So if they seem burdened, or maybe they were a little bit sharp with you, just keep in mind that it likely has nothing to do with you. It's more likely that it has to do with things that are happening around them on this particular shift in terms of their workload. So you might want to just acknowledge that it's really busy today, and is there anything that you can do to help? Be appreciative. So sometimes we simply forget to say thank you. So start your shift by thanking them for the opportunity and tell them that you're eager to learn from them. So, and thank them at the end of the shift too. So as I said, a simple thank you can really change somebody's day. Be helpful. So you likely are going to have less patients, and the patients that you do have are likely going to be less acute patients when you're first starting out. So if it's appropriate and you have time, offer your assistance. So ask if they need any vitals done. Does anyone need to be ambulated? Does anybody need help turning a client? An extra set of hands is always welcome. Make sure you're asking questions. So if you're asking good questions, it's a good reminder to your preceptor that you value their knowledge and expertise and that you do want to learn from them. And of course, be a team player. So nursing is definitely a team profession. And the best way that we can meet our clients' care needs is through that collaboration process. So if you show this from the start, it is going to help ensure a positive experience. If you choose to kind of be done with your duties for the day and then you proceed to just kind of sit at the nurse's station playing with your phone, well, that might not be the impression that you want to give to the team. And I read this next quote and I thought it was very fitting. Remember that sometimes it's not only the patient who needs extra compassion, but also the nurse standing in front of you. And I think that's very true, especially in our current situation of nursing shortages and the sick calls and the overtime, and of course, the pandemic that we're still dealing with. So just as there's benefits to being a preceptor, of course, there's a lot of benefits for the student as well that I want to talk about. So for one, this is where you Sorry, everybody. I don't know what happened there. My connection just lost. I think I'm back. Faye, can you hear me? I'll just ask you to unmute for a minute.
I can hear you.
Okay, I'll just bring the screen share back up. I don't know what happened there. Just lost it for a second. Faye, can you see the screen benefits for the Precepti?
I can. Okay,
perfect. Okay, sorry about that. Forget where I was. It just totally went dead for a second. So being part of that interprofessional team. So again, as I said, you're not just working with nursing professionals, but also the doctor, physiotherapist, the occupational therapist, social workers, dietitians, all those people who make up the healthcare team. So that's a skill that you're going to use throughout your career. It's also your opportunity to gain knowledge that's not taught in the classroom. So as I said, lab simulations are wonderful. They're great introductions to those nursing interventions, but there really is nothing like doing the real thing in real time. And that goes for more than just the technical skills. So students are often very keen to learn the tricks of the trade. So if we're thinking of self-care, they might have questions about, how do you get yourself turned around from doing days and nights? How do you keep yourself awake and alert to give good care at night? How do you emotionally separate from traumatic events that you might witness with your patients? How do you show compassion to a particularly challenging patient? So questions like that. It's also where you're going to start to gain your confidence and experience. So we're all very timid when we first start out and doubt our abilities. But as we get more exposure and experience, this is how our confidence grows and we start fine-tuning our skills. You're also going to learn about time management. So that's extremely important in nursing. So you will all have, 8 to 12 hours to complete all of your duties, which might sound like a long time, but I'm sure that many on the line here today are going to tell you that there is never enough time. So you do need to be able to balance the tasks that you're completing along with the documentation you have to do, giving a report, making sure you actually get a break at some point within the day, meeting all those care needs promptly, what do you do when 3 of your patients need to be prepped for a procedure. Things of that nature are a really fine balancing act. It's also going to give you valuable practice in terms of your communication, your critical thinking, and your collaboration skills. So for a short while, you will have your preceptor with you to talk you through all those assessments and decision making, but soon you'll be doing this without them by your side. So you do want to take advantage of that time and continue to ask questions. And lastly, this is where you'll really start figuring out your personal nursing identity and what area of practice you think you would enjoy the most. So you might have an interaction with either a client or your preceptor or maybe even another team member that really impacts you and stays with you throughout your career in terms of your practice and what kind of a nursing professional you want to be. So it could be a positive interaction, or it could even be a negative interaction that you've experienced that really stuck with you and made you think, I'm never going to do that as a nursing professional. And that can be equally valuable to you. So this next slide just offers a few pieces of advice for students during their preceptorship. So of course, don't adopt I'm just a student mentality. So Your work and your knowledge is valuable to the patient and the healthcare team, so don't be afraid to share your thoughts and your assessments. You might actually pick up on something that others have missed, so do, have some confidence in your abilities. Make sure that you're seeking guidance and that you're asking for help when it's necessary. So never do something you're unsure of because you're afraid of looking incompetent. So certainly don't take chances. Be open to new opportunities and make the most out of each placement. So there's going to be times, I'm sure, that there's tasks that they need to be performed that we're not thrilled about doing, or we're going to have clients that might be less than pleasant, but that's all part of the learning process, and we have to make the most out of each opportunity. So you might be asked to do something that perhaps you're just completely terrified to do, or maybe it's something that you think is just too hard, but it is your opportunity to practice alongside a skilled professional. So do take those opportunities. And I think this next one is a good piece of advice for everyone. Take what others say with a grain of salt. So don't rely on what other people might say about your instructor, your preceptor, or anyone on the unit. Everyone's experience is unique and we all perceive things differently. So just because someone didn't get along with a particular person doesn't mean that you won't get along with them, because as I said, we're all different, right? And that really goes for anything in life. I'm sure we can all think of a time when someone told us that a particular person was just awful and horrible, but yet we get along with them just fine. Make sure you're maintaining that open communication with your preceptor. So ask for help when you need it and ask those good questions. And don't forget to advocate for yourself. So if you do have a different opinion other than your preceptor in terms of client care, just talk it out with them professionally so that you understand the rationale. Share your assessments and your opinions. And if you feel like you're not getting enough guidance or support, or maybe even exposure to client care, just talk with your preceptor. Just as we advocate for our patients, we can also advocate for ourselves to ensure our learning needs are being met. And I want to add in a few notes regarding how instructors can help with preceptorship. So although I know the instructor is not the one providing the preceptorship, you can help prepare your students to start off on the right foot of their preceptorship. So throughout their program, you do want to ensure that you are providing that support and guidance and appropriate supervision so that they know when to ask for help and won't be afraid to ask for help when they need it, when they get out there doing their clinicals. You want to maintain that open communication with your students and kind of be that safe place for them to voice any concerns or fears or frustrations that they might have. Make sure that you're always sharing your expectations with your students right from the start. So do set a precedence for them. That way students know right from the start what you expect from them and that you will be holding them to a high standard in a way that's reasonable and supportive. It's a tough old world out there, as we know, so it is better to set them up for success rather than being too soft with them. It's also always helpful to share your expertise and your experiences with them and push your students to develop their skills and knowledge. So I do find that we all learn best from other people's stories. That's what kind of stays with us, and having those supportive role models that we can then strive to emulate in our own practice. And lastly, of course, we want to be a good role model for our students. So in short, it's just kind of like a practice what you preach. So we talked about this in our professionalism webinar, if any of you watched that one, and the research really shows that students are going to remember what you do and not what you say. And as educators, we really have to be aware that students are also always watching you. That's how they learn. So if you've been teaching your students to make sure they've got, clean short fingernails, no jewelry, they're dressing professionally, leave your phone in your locker, things like that. And then you're doing clinicals with those students and you're coming to shift with long artificial nails and dangling jewelry and speaking unprofessionally at the nurse's station and texting on your cell phone. Students are definitely going to pick up on those sorts of things. So as we finish here and we start into our panelist discussion, I just have a few final reminders to wrap up the presentation. And really just a simple yet difficult piece of advice is to simply be kind to one another. So for preceptors, remember what it was like to be a student. You likely were nervous, scared, worried, all those emotions we talked about. Your student is definitely feeling the same way. Also, your students are going to eventually become your coworkers, so welcome them to the team. So, you know, if we face it, like, we should be really excited for more staff that's coming to help with this nursing shortage. So we don't want to turn them off from nursing by being really terse or impatient and standoffish. We need them for sure. And as always, be supportive, be encouraging, guide them, and collaborate with them at all times. So as my little cartoon says, let's remember that new nurses are our friends, not food. And for the preceptees, so the students, as I said, remember to say thank you and often. Respect your preceptor's knowledge and expertise. So if you don't agree with something, talk about it. There might be a really good reason for it that perhaps you just don't really understand yet. Offer your assistance where appropriate, so certainly be that extra set of hands that everybody's looking for, and be a team player. So as I said, nursing is a team profession. It cannot be done alone. If you want to be part of the team, then certainly be a team player. So we're going to switch gears for the last time here and hear from a fairly recent LPN graduate and a practical nursing instructor from NBCC to speak of their experiences with clinicals and preceptorship. So I do want to just introduce our two guest speakers to you now. So our first guest speaker is the LPN Dawn Polches. So Dawn graduated from the practical nursing program from NBCC Fredericton in 2019, and she's accumulated a vast amount of experience in her short time as an LPN. So she first started working at the Dr. Everett Chalmers Hospital here in Fredericton and completed her preceptorship on the general surgery unit. She floated throughout the hospital extensively. At the same time, she also started working for the organ and tissue program and worked both jobs until the pandemic hit in March of 2020. Once the pandemic hit, she was redeployed to the mobile testing unit where she performed COVID testing in people's homes. And then she then moved on to the Riverstone Recovery Center here in Fredericton, where she worked with individuals who have substance use disorders, where they utilize a harm reduction approach. So Dawn is now back to working at the Chalmers Hospital on general surgery again. So I know Dawn's going to have a lot of insight to add to this conversation, having been both a preceptee and a preceptor. And our second guest speaker is Faye Hunter, who's an instructor at NBCC Fredericton. So Faye is a registered nurse and graduated from the BN program at UNB in 1989. Faye's worked in a variety of practice areas, including oncology, ICU, pulmonary medicine, community mental health, youth corrections, and with the extramural program. Faye's been an instructor since 2011, and she's worked across the curriculum with both first year and second year students. Currently, she mainly instructs in the areas of medication administration, abnormal psychology, maternal newborn, and pediatrics. And she also facilitates classroom labs and takes students out on clinicals. So again, Faye is going to have a lot to share on this topic with her experiences working with students. So I do want to give just a warm welcome to both of you and thank you so much for being here today. And we will get right to some questions because Dawn is actually at work right now, but her employer graciously gave her some time to take part in this very important discussion. So welcome, Dawn and Faye.
Hi, Kathy. Thanks for having me.
Hi. So there they are, everybody. So I'll start right with the questions because I know time is of the essence for you, especially Dawn.
Yeah.
And then maybe we'll have some time for a few questions from people on the line. So Dawn, sure. If you look back at your first clinical placement as a student, how did you feel leading up to your first day?
I was scared to death. I had no experience in healthcare at all. I remember not sleeping that night. I remember practicing all of the different skills in the lab, like giving the patient the call bell and introducing yourself and putting the bed low, like all those types of things. And I kept going over and over in my mind, am I going to remember to do those things? Am I going to leave the patient high and they're going to fall? Those types of things. It was actually very, very scary. And I remember something one of my instructors, Joanne, told me, and she said she gets nervous when the students aren't nervous. So it let me gauge where I was in the right place, knowing that I was nervous. Yeah. But getting there, I realized that it was a very supportive environment. All of the workers, my first experience was at York Care Center, and very busy place, but all of the workers were incredible. We could go to the instructors about anything. I had a very positive experience. I remember also being nervous about feeding patients because I know that it can be very risky if they have swallowing issues and stuff like that. But I mean, I got through it clearly, and I enjoyed it. So
good.
My
So Faye,
experience.
sorry. So Faye, I'll ask you the same question, but maybe from a different perspective. So as an instructor, how do you feel the first day you're taking students out on their first clinical placements?
Well, I'm very much like Dawn. I don't sleep the night before. I watch the clock. And that anxiety stems from not knowing the students, and not knowing how they learn. But predominantly that anxiety stems from, going into the setting and how will we be received, and, what's changed in the setting since the last time I've been there. And so COVID has impacted that tremendously. So just generally wanting this to be a really good experience for everyone, for the students, for the staff on the unit, and how do we work collaboratively with everybody at being student-wise, being at, unique individual places. We have specific competencies to achieve. Everybody's going to achieve them at different rates, right? So we have to allow for that individual aspect, but we all have to get to the same point. So a lot of times some of that anxiety too is, how do I take that student who's really strong and challenge them, but get my other student who needs a little bit more time to get there? How do I give them that opportunity as well? So kind of just juggling and balancing all of that. I want the students to be able to have a positive experience. I want the staff to have a positive experience. I want the students to be excited about the profession, to be excited about being in healthcare, and not for them to predominantly have kind of negative takeaways that maybe at home at night they go, have I made the wrong choice?
Yeah, for sure. Awesome. So Dawn, when you're thinking back to your first clinicals in preceptorship, did you feel comfortable and confident asking questions of your preceptors? So did they give you kind of that open and ongoing communication to help facilitate that?
Oh, absolutely. I remember another thing, clearly whatever Joanne says sticks with me, and again with Faye too, because I had them all, but it did stick with me. She said, if you don't ask questions, that also is a scary thing, because that lacks competency, or that shows a lack of competence. So I just remember, like, even if I don't know, don't be afraid to ask a question. Like, there's no stupid questions, so don't be afraid. Just jump in there. Like, if you don't know how to do a skill, let's go look it up with your preceptor or your clinical instructor. There's no shame in that. There's no possible way you're going to remember to do something, especially if you've never done it, number one. Mm-hmm. And number two is if you're not doing it on a daily basis. It's like you always got to refresh those skills. It's like with the association, you're always the continuing competency. Sometimes you have to refresh those skills. So yeah, ask lots of questions.
So when you're preparing students, Faye, to start out on their clinicals, is there any sort of advice that you give to them to ensure that they're going to ask those questions and stay in good communication with their preceptor?
And that communication component, that's really, that's key, kind of that nobody knows everything. And we've given you this kind of general education and experience in theory and in lab. And then we have to then take that into the clinical setting. And so in order to clarify, things, you need to communicate. So I try my best to kind of establish right from the get-go. Most of the units I've been to over COVID, no longer do the taped report. So you're standing at the desk, and night staff's giving verbal report, the day staff, and then you have a student standing, wanting to get their report for their assigned patient. So, just kind of how would this best work for you? Do you want to get report first, and then the student will come to you, afterwards? Because I don't want to, start out on the wrong foot. I want to kind of give them the opportunity to tell us how they would like to see it happen, that what works best for them. So just that communication piece, and then being very clear, because I'm sure in the hospital setting, you've got a group of students coming and they were working on these competencies, and now what's this group of students working on? So really being clear, what is that student going to be responsible for during that shift? How long is our shift? Just really kind of trying to have that clarity so that there aren't any gaps in that information. You know, and students, I tell them, I want you to come to me with any assessment information that you need clarity for. I want you to come to the staff person who's also assigned to the patient, so that they're aware. So really that communication is essential. Oftentimes when the staff person gets report, you know, and say, the student says, I'm going to be doing that dressing, you know, it's done Monday, Wednesday, Friday, today's Wednesday, so I'll be doing that dressing. And the staff person generally will say, well, I actually haven't ever seen that wound. So you let me know when you're going to do it. I'd like to come in and have a look at it. Or if it's a wound that the patient needed medication for. So then, you know, come get me, we'll give that medication 30 minutes before, and then I'll come in and have a look at it when you get that bandage off. So generally just that setting that communication and that collaborative kind of approach right from the get-go, really try and work hard to kind of establish that.
Mm-hmm. Excellent. So Dawn, without, of course, sharing anything too specific, did you ever witness or feel that there was a negative attitudes towards students from other nursing professionals? And if you did, how did you handle that? So what kind of advice might you give to students that are listening today if that happens?
I personally never experienced it. Not that I can recollect anyway, but I've definitely seen it. But I think the biggest thing when that does happen is when somebody's not being assertive enough. And assertive, as we had chatted before, like assertiveness is definitely a skill that's honed over time, but it's really important, especially working in really busy units. And I knew early on that I wanted to work on the surgical unit. It's wild here today, and every day essentially, except for during the pandemic, it lulled a bit, but you got to be very the clear communication, the assertiveness. But I did notice a few weeks ago there was a group of students from UNB, and there was and it came to a breakdown in communication. The students primary wasn't very nice about something, and it wasn't because the student missed it, it's because the student was looking for clarification and wasn't able to communicate that properly. So again, it went back to just the breakdown in communication, and then that primary wasn't very nice. So it happens, it definitely happens, but in that moment you do have to be assertive and redirect that back and clarify yourself what you were doing or whatever. But I'm older, I had that advantage of going back to school. I was out of school for 17 years, had kids. So I think I really had time to establish that skill in my life. As a mom, you got to be like that with your kids, right? So I definitely had that as an advantage. And I do see younger people 20, 22 really struggling with that. So I would say that's a definite skill to work on. As Faye said, work on that at home, work on that in school with your peers, things like that. So that would be my advice.
Good. So Faye, do you sometimes see that sort of negative attitude when you're bringing students to clinicals, and do you kind of help prepare your students for the possibility of that happening? Any that you might want to talk to how they could maybe handle that situation if it happens to them?
For sure. Over the last 11 years, something that really is a benefit is returning to the same unit repeatedly and kind of getting to know. It's an asset as an instructor, getting to know the staff, so that you have that ability to go when you're developing your assignment and you go, oh, this patient would be a really awesome learning experience for a student. And then you know who the staff person who's assigned to that patient, and then you can kind of go, okay, so which student best fits with that individual, and having known a little bit about how that person works, so for example, I'll go in and I have on the whiteboard the student assignment on a list beside the assignment for days. I've touched base with everyone. There's a student in 40 bed B, and yet again, the staff person will go in and do all the vitals and the mini systems prior to the student getting into the room. So that just sends a very concrete message to the student. You knew I had the patient, but you went in and did that. But what that actually, when we discussed it, is that person absolutely has a rhythm and a routine to their day. And so to insert a student into that rhythm, they can't incorporate that. So then it was just about a dialogue. So despite that being a very good learning experience for the student, is that something that you can work with us on? Or is it just an absolute deal breaker and I should avoid assigning a student to you when you're working on the unit? And she was very clear. It was a deal breaker. Don't assign. And so just for the purpose of having a good experience for the student, we kind of negotiated then the reason why that person was a really good learning experience was X, Y, and Z. Would it be okay if we went in there with the patient's permission and did this particular component of that patient's care? So there's often ways to kind of negotiate those challenges without leaving the student feeling, I would say that the students in those circumstances felt that incompetent. But it would be almost like you'd have to tag the desk and run down in front of her and get in the room before she got in there. So there really wasn't any value in that. But she was open when we communicated, and we were able to kind of negotiate so that it was kind of a win-win for both the staff person and the student in the end. And just Dawn was talking about assertiveness. When I mentioned, knowing the staff, if I have somebody who I know, maybe their communication style might be a person who's not that assertive, find it hurtful. They may find them abrupt. They may then be walking away going, what did I do wrong? But that's that person's communication style. So maybe matching somebody who's more assertive, whether that be like Dawn, somebody's a mature student with some other life experiences coming back in, so that having that awareness right from the get-go, you're trying to establish, that positive environment right from the start.
Mm-hmm. Perfect. So Dawn, maybe you could just share, if you think back, you completing your preceptorship and your clinicals, was there something you would say was kind of your most valuable takeaway or experience? Maybe it was a technical skill, maybe it was something you learned from a patient, maybe it was one of those nurse life hacks that we hear about that kind of stayed with you after your preceptorship?
Yeah, and Faye can probably attest to this. I'll give you a little backstory. I love doing skills. I love learning. I consider myself a big dork. And I remember one specific day, I was on orthopedics, and one of the instructors had given me a patient, and they were like a nursing home placement, as we would term it, I guess. So there wasn't really many skills to do. And I thought, well, I'm not challenged today. Like Faye said, you're looking to challenge those students that do that. And I am self-admittedly one of those. And so I went to the instructor and I was like, kind of bummed about it or whatever. And she said, well, why can't you have them? They're not beneath you. They're a patient. They need care. And I kind of like checked myself a little bit, like, maybe my attitude's wrong. But I remember going in and doing their AM care. And this is somebody who had been in bed for, I can't even remember the details or the specifics. It doesn't matter. But I remember washing her hair and she cried. And it made me realize that day, skills are cool. Yes, I love to do it. I love wound care so much. but it's in the little things that really matter and that really help patients get better. Like something as small as applying lotion. You can hear patients like, oh, that, you know, that feels so good. They're not getting that. They're like, especially now during the pandemic, there's nobody that can visit. If they're in here for 14 days is only when they might be able to get a designated support person, but it's not everybody that's getting that. So I really had to check my attitude a little bit that day and realize, like, we're going to do skills for the rest of our life. It's what nursing is, depending on which area that you choose to work in, but it's in the little AM care, like brushing teeth. Like those are the things that really matter at the end of the day, and that really matter a lot to the patients. Like we know ourselves how good it is to go home and take a shower after a long hard shift, or brush your teeth, you know, after they're feeling kind of fuzzy. So you forget that sometimes, you know, as you're going about your day and you're busy and you got 5 patients to look after. But that's one thing that really stuck with me ever since one of my clinicals.
Perfect. And so Faye, I'm sure you've done a ton of clinicals with students. So do you have any valuable takeaways or experiences that have kind of stayed with you through doing those clinicals with students? Something, or maybe something you always tell your students?
I always tell my students, so I'm not sure what it's like in other hospitals, but the discharge planners are always at the back desk. When they arrive to do their work, they're at the back desk. Well, on most units, that is where we are as well, right? Doing our charting, talking through what's important to document, looking at, you know, this is going to be your assignment for tomorrow. Have a look in the Perry and Potter at this, because you'll likely be responsible for it tomorrow. And the discharge planner on a specific unit came to me and took me aside, and, you know, that makes your heart drop. You're going, oh no, what's wrong? But what she wanted to tell me was that the students were so quiet and so respectful and so professional. She was so impressed by them, and she compared them to other groups who had been in the hospital setting and at the back desk, whom she'd had to ask repeatedly, you know, this is my workplace, could you please respect that, you know, and can you kind of tone it down a little bit? And I think there was even some, you know, oh, on Friday night at the 2020 club and things like that going on back there, which was pretty unprofessional. And so she said, I need you to bring this message back to your students. I am just so blown away by them. And so I tell them, I said, this behavior that you're practicing, people are noticing, and I'm getting good feedback about that. I'm getting very significantly positive feedback about that. So, you know, continue on with that. You're on the right path. And so, you know, to have a positive message in negative times is a really, really significant experience.
Great. So Dawn, now that you know you've had the experience from both sides, now you've preceptor students, you've been the preceptee. So what was it like being a preceptor for you? So, and I do want you to be honest, because we have to acknowledge it is more work, right? So maybe you can just talk about what that experience was like for you, preceptoring a student.
So I am an A-type personality. I, like, as Faye said earlier, like, this person has a rhythm and rhyme to their day, and then like everything's plotted out. Like I literally leave a report in the morning and I have a plan. And I know you have to deviate from that plan sometimes, but it's just I can get going about that plan and totally forget that I have a student. So I'm trying to be more acutely aware. Like today I have an RN student with me for the day. And I'm trying to remember what it was like when I was a student and wanting, again, those skills. So I had a patient that needed debridement today. So I asked the doctor if they were okay with them going over, and she got to go see that. I also had, you know, a patient with a PIC. She got to go to interventional radiology and see that. So I'm trying to be more intentional about like, hey, I have this. Do you want to come do it with me? Or do you want to do it? And I also have to ask the instructor, because I don't know what their skills are, you know, because I have some in 3rd year, some in 4th year and stuff. So I have to really be intentional about figuring out what's in their scope of practice at the time. But I'm finding it easier as I go on. Like first time I think is probably hard for everybody. You're trying to figure out your role and all that. But I feel like as I have students just shadowing for the day, I feel like I'm getting better. I asked that. I even do a little reflection at the end of the day. I asked her before she left. I was like, "Did you have a good day? Did you feel like you learned anything?" And she said she did. So it made me feel good. So, but it's not the easiest thing. On the other hand, some people like having a preceptee or a clinical or student for the day because they don't really want to do their work. It's just the reality of it. And then they go and they leave the student, and it comes time for the nurse to do the report on the patient and they don't know anything. I actually sat waiting the other day to tape my report, and the nurse reporting said 20B had a student all day and then moved on, gave zero report on the patient. So that's not cool either. So there's definitely a balance that you have to find. Like, it's lovely having an extra set of hands, especially like right now here on surgery. We were down surgeries for so long because of the pandemic, and now they've opened it up wide open. So we're getting fresh post-ops every day, and it's very, very busy. So that's a lovely part of it too. But it gets easier as you do it, I think.
Yeah. So my last question, and then if anybody has questions, they can type them into the Q&A box. Faye, I did want to ask you, do you think things in your career, you've been an RN since 1989, do you think things have gotten better or worse or stayed the same in terms of kind of like that bullying in nursing, the preceptoring? What was it like for you as a new grad compared to today, maybe?
I think it has changed dramatically. So I graduated and went to the foothills in Calgary and worked oncology. And at that time, 89, we had a nurse educator on the floor. So, you know, all those modules that are on Skyline, you have to do the module, do the test, and you get to do 3 supervised IV starts or whatever, and now you're certified. So that was the role of the nurse educator there, right? So she would take the staff, she had like a spreadsheet, which is probably on paper at the time because computers, you know, weren't that widely used. And she would come to you and she'd go, okay, we're having a class on Tuesday. You're coming in, and then I'll go with you and we'll do some central line care and draw some bloods and change some caps. And we did that together, and that was probably, in addition to the mentorship from the staff on the unit, that was key to that successful transition from student to practicing RN, and that confidence that when you went to do something, you had somebody that was completely 100% focused and dedicated to you doing that at that time. So as opposed to, in addition to somebody else's workload, they're going to mentor you and they're going to watch you. In their head, they're trying to figure out what they're going to do as soon as they walk out of this room, right? And what they have to document and who's going to the OR and who needs to go down to radiology or whatever that is. So I just really, for myself, as I reflect, just that ability to have those dedicated, acknowledged, formal mentorship situations on floors, instead of the informal, that was really valuable for me. I just, I know everybody's working straight out, and then to add that informal mentorship on top of a workload for people can be a lot. And we want our new grads, you know, to feel proficient, to feel supported. We want them to be there a year from now. So that's just, I can't say that I'm really familiar with the mentorship programs that may be in Horizon facilities, but I think that is a real key to retention of our students.
Yeah. And Dawn, do you have any final pieces of advice for students, or maybe somebody that's, you know, on the line here today that is considering preceptoring that hasn't done it before?
I would say ask lots of questions, like as a student, like don't be afraid to do that. I just came back from working in a clinic for the past 1.5 years, almost 2 years, and you don't really do a lot of skills there. And I come back to a surgical unit. So I brought someone with me when I did an IV start again. I brought somebody with me when I did an NG tube insertion. Like, I want to make sure that what I'm doing is not going to harm the patient. And there's no shame in that. I mean, it's, if you don't do it, you lose the skill. You look it up in Perry and Potter, and, you know, and you just make sure. Treat your preceptorship like it's a job interview. Like, everyone's watching you. I can't tell you how many times, like, there's students preceptoring here right now, RN students, and you hear the nurse manager saying, how's so-and-so? Like, what do you think of so-and-so? A big pet peeve of mine is looking students on their phone, even staff. It drives me nuts, if I'm being honest with you. It happens a lot, because I'm like, there's always something to do. You go down, like today I went down to my room and there's no more isolation gowns. Drives me crazy. I mean, not to say I never look at my phone, because I do, I have kids, but I mean, but if you're sitting scrolling through Facebook, I think there's a better use of time, you know, during the day. Yeah, just jump in, don't be afraid. I'm still nervous. And people, actually, my daughter asked me this the other day, because she has anxiety at school a little bit, and she said, you don't understand what it's like to have anxiety. I'm like, I do get it, but I push myself to, you know, if I'm doing a skill and halfway through, I'm like, is this right? You know, I think that's good. You ask questions, because I'm nervous too.
Yeah.
You know, but that's what I would say. Just make sure you're treating people with kindness. Like, today's anti-bullying day. Like, you treat others how you would like to be treated. That's what I try to do. And again, I'm not perfect. I don't want to sit here and think that I am. Like, it gets so crazy here, and tensions can get higher whenever it's so busy. And like last week, I was running around here and I didn't know what I was doing, because I had 3 very sick patients, and there's a very real nursing shortage right now. That's both RN and LPN. So we're finding that LPNs are getting very acutely ill patients right now. And you just got to really be on your game and try your best to be kind, and, you know, because you have to work with these people day in, day out. So that would be the best advice that I would have. You know, ask questions, jump in, don't be afraid. You got to do it at some point.
Yeah,
you know, a nursing home placement's not a bad patient to have. There's still things to learn, as I'm still learning that. So, and always be willing to continue to learn. That's why I jumped in. Like, I did cornea retrievals like 6 months after I graduated. I loved it. It was a great learning opportunity. So yeah, that would be the best advice that I could give.
Perfect. So I'll open it up for Q&A. These are just some references that I used to develop this. So there's some really great articles about bullying in nursing and how to address it and things, if anybody's interested in looking at those. Again, if you want to put a question in the Q&A box, and you have the option to ask anonymously if you don't want your name shown. If you're not sticking around for the Q&A, when you leave, you will see a survey pop up. I'd just love to have your feedback about the webinar. There's a few questions there. So if people could answer the survey that pops up, that would be great. And I do really thank everybody for joining us today. So I do see one question here. So if you have as a preceptee, a preceptor whose work ethics are what you think are questionable, is the preceptee able to have another preceptor that would fit with your own work ethics for a better learning experience? So I'll throw that to you guys first as the subject matter experts.
I would think Faye might be better equipped to answer that than me.
Not sure about that. This comes up where a preceptee and a preceptor, they don't, personality clashes, just communication style clashes, this kind of thing. And generally our feedback to our students is that this is going to be part of your work life. You are going to work with many people with different approaches, different styles, different methods of communication, different work ethics, right? So we try to encourage them to look at it as an opportunity, you know, to learn about this individual and learn how they manage to get their workload done in their shift. That doesn't mean you have to organize your approach to your day to mirror theirs, right? So you're learning something. You're learning that that's not how you feel comfortable working. So you're becoming more self-aware about the approach that you're going to use to your work. It's very unusual for us to switch preceptors unless there's some significant issue. So a couple of years ago, we had to switch a student to another preceptor on another unit because she was being bullied by her preceptor. So we will intervene in those situations. However, you know, we often also encourage the communication. Well, have you discussed this with your preceptor? Well, no. Oh, okay. So your first approach to any kind of resolving any conflicts would be that you have to have that communication with the individual, right? So, so just kind of, that's how we would approach a situation like that. We wouldn't rush in, you know, at 3 a.m. and go of a 12-hour night and go, okay, so you're off this unit and now you're going over here, or for the next shift. Preceptors are identified through their nursing manager. Generally, there's some approach, some assessment, some about who is going to be a preceptor. So generally, we try to work things out as best we can. And if we can't find any resolution, that would be perhaps when we would have to make a switch.
Yeah, I think you're right, Faye, because we are going to be working with all different walks of life, right? So we can't just say, I'm not getting along with them, I don't put me with them. We can't just say, I'm not taking that patient because I don't like them. We do have to learn to adapt to those situations. But like I say, if it's serious enough and somebody was actually being bullied, then that would be looked at for sure. So if anybody else has any questions, I'll just wait a few seconds to see if anything new pops up. As I said, you do have the option to send anonymously, so we won't know who you are. And if you want to ask a question later, my email's there. I can always forward it on to our discussion panelists as well. We'll just wait a moment. And again, thank you all so much for joining this afternoon. It was a little bit longer of a webinar, but it's certainly this is a lot to say on this topic for sure.